but we'll try not to keep you too long. Welcome, everyone. I appreciate the wonderful crowd that has come out today. Also, the words from a small business owner and from a healthcare provider here in the Valley. Those words really were taken to heart, and I realized that so many across the 6th District have the same stories and are going through the same burdens that small business owners, such as myself, and healthcare providers see every day. Today, I'm here to address the healthcare crisis that is bankrupting America. I say bankrupting because I mean quite literally bankrupting middle-class families, putting them through financial ruin. 51% of all bankruptcies in America stem back to healthcare costs. 1,525. That's the number of dollars spent on each vehicle by GM for healthcare. That's more than the cost of steel for each vehicle that GM has to put into just to cover the cost of healthcare for their workers. You see, this different dynamic with our healthcare industry makes it so that our industries are not competitive in a global marketplace. We should be taking those funds that GM is spending on healthcare and putting them into research and development so we can be the worldwide leader when it comes to hybrid technology, not other nations. But I guess the question is what's holding us back? Well, the answer is that the lobbyists and special interests prevent us from having meaningful change in our country. Ingenuity and innovation, trademarks, traditional trademarks of American industry, all stymied by the controlling interest in Washington. The doubling of our national debt was caused by interests that would rather give tax cuts to the rich as we increase spending in a war rather than continuing with a balanced budget. Trade and monetary policies that are augmenting what's being done in Washington have led to a sharp decline in our dollar. As a small business owner, I am painfully watching as our nation is forced to make tough decisions in what has become a fight for survival. I am part of a movement called Change Congress that wants to end this form of government corruption. And there are 4 points to the pledge that we take. One is to refuse PAC and lobbyist money. Secondly, we'd like to increase transparency in government. Third, we want to push for public financing of these federal elections so we can begin to have elections again and not auctions off to the highest bidder. Yeah. And fourth, we would like to rid our system of earmarks once and for all so we can begin to be fiscally responsible and spend our federal tax-paying dollars in a responsible way. This is the movement that's called Change Congress. And I stand with no less than 30 other congressional candidates around this nation that would like to have these substantial government reforms so that way we can begin to give power back to the people. With these type of systemic reforms, we can find objective long-term solutions that carry our nation forward. We can begin to find solutions to health care, the economy, no child left behind. These are the types of reforms that we need to be moving America forward. We need health care reform for so many reasons. We all have this feeling in the pit of our stomach that something's just not right. But yet, when we look around, there's nothing being done. Well, I'm here to tell you that there is something being done. There is a plan in Congress, and it's called H.R. 676. I believe in H.R. 676 because it is the best compromise that really addresses the largest problem in healthcare, which is insurance. H.R. 676 is a compromise because it combines the cost-saving benefits of a single-payer system with the freedom of a privately delivered healthcare system. So, the doctor you have now will continue to be your doctor. Hospitals will continue to run themselves. The government has nothing to do with managing healthcare facilities. So this is not socialized medicine. We would have a system that gives healthcare to all Americans, brings down healthcare costs, and allows for the freedom to choose your healthcare provider. This is a plan that moves America forward, and this is a plan that works. As your next congressman, I will work diligently to build support for and pass H.R. 676. But there are some ways that we can be improving the healthcare system in the very short term. I support giving small businesses tax credits so that they can provide health care to their employees. We should give persons with disabilities the care that they deserve. And also, we should digitally integrate our medical record system so that way we can have a national system of sharing patient information. In closing, for American industry, for American jobs, for the American middle class, we must find a solution that really works. We must start by ridding the system of these lobbyists and special interests that choose to mute the voices of the middle class and pushing for the passage of H.R. 676. Let us unite today as Republicans, Libertarians, Democrats, and Independents to take back our legislature, to take back our government, and to give a voice back to the American middle class so we can start moving America forward.